Hi, everybody. It's Parker with Dailey Aesthetics and Hormone Clinic here with my friend Tim, who is actually getting the Morpheus8 body. We're really going to focus on upper pecs and kind of the abdominal section to kind of tighten everything up. Tim has actually lost quite a bit of weight, and so he does have some skin laxity that he really wants to address with us. So this will be your second treatment with us. So the first time that we did therapy, I didn't tell you a whole lot about it, but what was your experience that first time with therapy?
It was fun. I just kind of sat there and got numbed up for a little bit, and then I laid down and the first injection went in, and I wasn't quite expecting it, but once you got used to it, it wasn't too bad.
Okay. On a scale from 0 to 10, 10 being the worst pain, what would you describe that treatment as?
In terms of pain, I would say, I don't know, 4 or 5. I mean, it was there, but it wasn't anything anybody can't handle.
Okay. And then how was post-treatment? How was redness? Any pain afterwards? How long did redness last for?
The redness was there for about a week or so, I would say. It was a little itchy like the second or third day post, but that lasted 1 or 2 days. The worst part was when you made me shave and just the texture of my clothes on my that was the worst part.
So yeah, we did have, Tim is usually a pretty hairy individual, but we had him for that time and this time kind of buzz off his body hair, because if you have that hair in between your device and the person and the skin, it actually can interfere with some of those radio frequency positive and electrons that are kind of going on there. So it's better to have the patient kind of shaved for that. So, but yeah, we're gonna put a topical agent on Tim here. Again, we're gonna focus on kind of upper pecs. Because with him, he did have some sagging under here that he was not comfortable with. So if we tighten the skin up here, everything is just going to kind of lift that way. So yeah, we're going to go ahead and we're going to put some topical numbing agent on him. We'll wrap him up in saran wrap, let him sit for about 45 minutes, and then we'll be back. Alrighty, guys, we are here with Tim again 45 minutes later. We did put some topical lidocaine on him, so he has a little bit of decreased sensation. But I already have him wiped off and cleaned off, but we're just going to do a quick little swipe this way just to make sure that everything is nice and clean. And then we're going to work on upper pecs first. So I'm not going to start, I'm going to do what's called a burst mode. So it's actually going to start at the furthest, deepest point in the skin, and then we'll deliver at certain depths of frequency for treatment. So because the skin up here in the pec is a little bit thinner than it is down here in the abdomen, I'm not going to do a 7 millimeter here. I might go down and do a 5 millimeter. So it'll hit a 5 millimeter, a 3 millimeter, and then it'll hit a 1 millimeter on top of that. So, but I'm going to warn Tim this time. I'm going to start off on a low energy, and then we'll slowly kind of work our way up as tolerable. Okay. All right. We're going to do right here. But 1, 2, 3. That's it. Too much? Pretty good. How was the energy on that? Was it too painful, or do you want to go up? Increase that. Here we go. 1, 2, 3. Better? A little bit more painful?
Yeah, a little bit more.
Want to try up one more time? And then if this becomes too much, we'll just decrease you back down. Sounds good? Yeah. So we'll keep it at a 15 for now. And so what we're doing here is actually we're going to cause all of this skin to shrink up here, which will then raise and kind of get rid of these under pec lines that he is worried about. And since we're hitting at 5 millimeters, 3 millimeters, and 1 millimeter, we don't need to really do a second pass, but we're going to do one just to make sure that we got a lot of what we needed. So we're actually going to go in a different motion this time. So what are you experiencing when we're doing this? What are you feeling?
Just a little prick. It's just in some areas I'm less with some.
Okay. So that is good for the 1. And the good thing with this is because we're doing it at multiple levels, we're not going to have to go over it at a 5 and then a 3 and then a 2. It's just one pass, and then we'll do it at a different way that we did before. So we're going to move on to this pec here.
last one. That's great. Yeah, 1,000 pulses. That's kind of what we had last time.